Hi guys, it's Doc Janelle. Welcome back to my channel. The subject at hand is community and public health, and this is the second part of our introduction topic. The topic now is public health. We have already given a definition to health, and we said that health is not the mere absence of disease, but it is the interaction or the balance of a person's physical, mental, and social well-being. Moreover, health comes from the German word Heil, which means whole or sound. According to McKenzie, our reference, health is a dynamic state or condition of the human organism and is considered multidimensional. When we say dynamic, it means that there are many factors that contribute to the health of an individual. And the overall state of health is actually very dynamic, or it is constantly changing. A person can be healthy at one point in time, and then it can be sickly or not considered healthy at another point in time. So what are these factors that affect health, no? There are 5 factors, and in order to be considered truly healthy, then a person must take care of these dimensions. These dimensions include gestational endowments, social circumstances, environmental conditions, behavioral choices, and medical care. Let's talk about them one by one. So, these determinants affect a person's or an individual's health. First is gestational endowments. When we say gestational endowments, this include your genetic makeup or DNA. Meaning, even if you do not have any abnormal behavior, even if you do not live a risky life, even if you do not have any vices, no, you are not exposed to diseases, and let's say you have a good economic, educational standing, then that does not mean that you will be free from any disease, because your very DNA, your own genetic makeup, can actually contribute to your health status, no? Remember that some diseases can be inherited, and recessive traits can actually become determinant. So what diseases ba are inherited? You have your hypertension, your diabetes, your asthma, your cancers, no? These are only some of the diseases that can be passed on from one generation to another. So even if you live a perfect life, it may be through your genetic makeup that you can develop diseases eventually. Second, your social circumstances, no? A person's educational status, their employment, the average income that they receive, their poverty level, their housing, the crime rates at their community, and the social cohesion all contribute to a person's health. So let's say, when we compare a person with low educational attainment to a person who has high educational attainment, we can definitely agree that the person with high educational attainment would probably prioritize his or her health better. If the person is employed, then he will have the financial resources to seek for medical help as compared to a person who is unemployed. A person who is living under poverty would probably prioritize food and shelter over medical attention, right? So all these social constructs can actually factor in to a person's health. Third is the environmental conditions, and this includes where people live or where people work, the hazards present in their environment, and the toxic and microbial agents where the person can be exposed to. So let's say people who live near esteros, people who live near yung mga kanal, di ba? They are very prone to diseases. If, let's say, the rainy season comes and the water comes flooding, very prone to leptospirosis. Their water sources can be contaminated, producing cholera and amoebiasis and gastroenteritis. People who live near the payatas, no? People who live near Spooky Mountain, the garbage disposal areas, they're very prone to many other diseases as compared to people who live, let's say, in a private subdivision where there is no dirt, there are no garbage, and there are no esteros near. Diba? So, yung environment can also affect yung health ng isang tao. Number 4, behavioral choices. Your personal choices and habits, whether it be your diet, your physical activity, the way you use substances, no? And even abuse of substances. That can definitely take a toll on a person's health. And lastly, availability of quality medical care. So, even if you are the richest person alive, if you live 3 hours away from the hospital, your chance of surviving from, let's say, a heart attack is lesser as compared to a person who may probably just be earning average income, but who lives near a hospital, even if that person may have a low social circumstance, but because there is an easily available quality medical care, mas mataas yung chance of living nung tao na yun, hindi ba? So the distance, the price difference, and even the number of healthcare facilities can actually affect a person's health. So I want to tell you that these determinants of health, they factor in or they affect an individual's general health. Okay? Individual yung pinag-uusapan dito. Other broader determinants of health include the following, but I do not need you to memorize this. I just want you to understand that these determinants of health gives us a glimpse of the complexities that arise when we consider the deceptively simple question, bakit mas healthy yung isang group of individual compared to the other? No? Why is a certain group of individual less likely to be healthy as compared to this group? So there are many factors which can actually play into the reasons why. Diba? Pwedeng culture, pwedeng migration, the territory, pwedeng yung mga nabanggit natin kanina, educational endowments, social circumstances. So there are many reasons why a person's health is at a certain level at a certain time. So when we say public health, we already gave this definition earlier. When we say public health, this includes activities. Activities because, as mentioned, it is through organized efforts, no? So this includes activities that society takes collectively to ensure the conditions in which people can be healthy. As mentioned, when we say public health, it is the machinery, it is the system in order to provide everybody with the best healthcare delivery system. Okay? And when we say public health system, these are now the public health activities provided for by the government and the private and voluntary organizations and individuals. Okay? So, once there is a cooperation between government, private, voluntary organizations, and even individuals, then we will be able to create a public health system. Global health has already been discussed in the first lecture that I gave, but generally it refers to health problems, issues, and concerns that transcend national boundaries. No, it does not remain in a certain nation, but it includes a certain continent or multiple continents. So, a global health of a certain, the health of a certain nation may be influenced by the circumstances happening in another country. So, an example of this is when there is a war, no? So even if your country is not included in that war, your country will still be affected, no? Because of the circumstances happening in other nations. So how do we address issues and problems on a global health scale? It has to be through cooperative actions and solutions. So just like in COVID-19, vaccines are being shared all throughout the world, no? Best practices are being shared all throughout the world. And that should be the way to address these global health problems and issues. Now, what are the factors naman that affect the health of a community? Kanina we talked about factors or determinants of health that affect an individual's health status. Now let's talk about factors that affect the health of now a community. There are 4. First are physical factors. This includes geography, the environment, the community size, and the industrial development. No? So, people living near the coastlines can be less healthy than people living in a private subdivision. Why? People living in the coastlines very prone to typhoons, very prone to ocean surges, very prone to tsunamis, no? Very prone also to animal attacks, let's say, no, mga shark attacks, etc., as compared to people living in, say, in a private subdivision. So geography, environment, the development of the place will definitely have a factor to the health of a certain community. Second are social and cultural factors. This includes your traditions, belief, the economy, the politics, religion, social norms, and socioeconomic status of a certain place. So let's take religion as an example. A certain religion does not believe in blood transfusion. So those people who belong to that religion might have a lesser chance of surviving from, let's say, a traumatic incident because they do not want to receive blood transfusion. So those kinds of beliefs, traditions will really factor in to the health of a certain community. Okay? What else? Community organization. When we say community organization, this is the ability of a community to unite and identify common problems in their community and propose a unified solution to those problems that they identified. So, important that a community is organized, a community has unity, a community has a leadership, or else they will not be able to come up with common problems, di ba? Iba-iba sila ng gustong i-address. Iba-iba rin sila ng gustong mga solutions to solve yung mga iba't ibang problema. So kung nagkakanya-kanya ang community, there is no community organization, then their health will also be affected, right? And lastly, individual behaviors, no? The behavior of the individual community members will definitely contribute to the health of the entire community. Let's take COVID-19 as an example. Let's say in a barangay, everybody has decided to receive the COVID-19 vaccine except for one family. And this one family went to a reunion or a vacation, and because they are not vaccinated, they got COVID-19. They then went back to their community, interacted with their neighbors, interacted with the rest of the community, unknowingly carrying the COVID-19 virus with them. Then COVID-19 spreads. So the individual behaviors of the members of the society or community can definitely affect the health of the rest of the community. So again, remember these 4 factors that affect the health of a community. Next, let's talk about the history of public health, starting with the early civilization. So the earliest community health practices were actually unrecorded. History just started with the common knowledge that it was wrong to defecate near sources of drinking water, the dead were already being buried, and herbs and spices were already used for curing diseases. However, in the 1900 BC, the Code of Hammurabi was discovered, and this was considered the earliest written record of public health. It included laws for physicians and health practices. It was then followed in the 1500 BC by the Book of Leviticus, which is actually a book in the Bible. And it includes guidelines for personal cleanliness and sanitation. These 2 records are the earliest records of public health practices. In the classical cultures, in the time of the Greeks and the Romans, from 500 BCE to 500 CE, they already knew about water sanitation. In fact, they already started an aqueduct system, meaning they formed passageways for water to reach the far-flung places. So provinces which may be far from water sources already received water through the aqueduct system. They also had infirmary buildings, meaning clinics, and also charitable organizations. In the Middle Ages, from 500 CE to 1000 CE, this was considered the Dark Ages of public health. Why? Because it was the spiritual era of public health. Diseases were thought to have spiritual causes. So there was a failure to take into account the role of the physical and the biological environment in the causation of communicable diseases. And because of this resulted in many unrelenting epidemics in which millions suffered and died. One best example is Black Death, also known as the bubonic plague or the Black Plague. The Black Plague was actually caused by a bacteria called Yersinia pestis. So the bacteria of Yersinia pestis would infect rodent fleas, yung mga garapata at pulgas na mga daga. These fleas would then carry the bacteria and would be transmitted to mice. The mice would ride on the ships during galleon trade, and then once the trade is done, the goods are brought to a certain country. The rodents would go to the communities, and the fleas would infect people. And because of this, a lot of people died, no? In fact, 25 million people died in only a span of 4 years. Moreover, half of the population of London was lost, and in some parts of France, only 1 out of 10 survived. And you know how the Black Death ended? It ended with the public health action of quarantine. So, quarantine started in the Black Death, and until now, we use that principle to end COVID-19. Other diseases that became a public health concern during the Middle Ages include smallpox, measles, influenza, and some other diseases pa. It was not until the 18th and 19th century, which is considered the modern era of public health, that things started to change. Lemuel Shattuck outlined the boards of health, and boards of health is very important. It's like the DOH of the early times, no? So he created a government, a system who collected vital statistics, who implemented sanitary measures, and who really dived into research in order to meet the needs of the public in terms of health. Moreover, Louis Pasteur proposed the germ theory, and the germ theory believed that certain diseases are caused by the invasion of the body by microorganisms, and microorganisms are organisms too small to be seen except through a microscope. Because of this proposal by Louis Pasteur, in 1875 to 1900, it was considered the bacteriological period of public health. So, now that they discovered microorganisms and that these microorganisms can cause diseases, all diseases na were believed to have been caused by bacteria. But then it was balanced off by Robert Koch when he established that specific bacteria can cause a specific disease as well. So not all diseases are caused by bacteria. Certain bacteria can cause a certain disease, no? But not everything. And that gave rise to the Koch's postulates. So the Koch's postulates are very important. You will encounter them even when you go to your third year, even to the board exams, they will ask you this question. So please read up on the 4 postulates by Robert Koch. So eventually, Robert Koch also found the causative agents for gonorrhea, for typhoid fever, leprosy, tuberculosis, and many more diseases. In the 1900s to 1960, this was considered the health resources development period. So there was a period of increased growth in healthcare facilities, mainly because the government now believed that if people are healthy, then progress will follow. In 1960 to 1973, this was considered the period of social engineering, whereby Medicare and Medicaid were established, and these 2 institutions assisted in the payment of medical bills of certain populations who could not afford medical care during that time. And this included older adults, people with disability, and the poor. From 1974 to present, that is considered the period of health promotion, the passage of multiple healthcare laws and programs, specifically in the United States. In the Philippines, prior to the colonialism under the Spanish rule from 1565 and earlier, it was considered the pre-Spanish era. So health was believed to be a harmonious relationship with the environment. So somehow similar, no, doon sa Middle Ages, the spiritual ages of public health. So diseases were believed to be caused by this harmony with the spiritual world, and the healers during that time, the doctors during that time, were actually called babaylans. They were priestess who would talk to the spiritual world, who would talk to nature to somehow find a cure for the sick people during those times. Eventually, when the Spaniards came to the country from 1565 to 1898, the role of the Babaylans were replaced by the Spanish friars. So they became spiritual and medical frontiers during those times. And it was also during the Spanish era that the first hospital in the Philippines was established, and it was called Hospital Real. It was built in Cebu in 1565, but it was relocated to Manila later on. Intramuros during the 1900s became the center of health and medicine. And it was also the time of the epidemics during the Spanish era, no? And because of this, many hospitals were built, such as San Lazaro Hospital, UST Hospital, San Juan de Dios Hospital. The epidemics which found its way to the Philippines were in 1574, smallpox, also known as bulutong, but now bulutong is more famously known as chickenpox, no? And in 1583, the cholera epidemic. During the American occupation from 1898 to 1918, there was the establishment of the Board of Health for the Philippine Islands. BOH is like the DOH that we have now. So from the military rule of the Spaniards, it shifted public health into a civil government. And there was the establishment of the BOH, which really took care of the public health issues of the nation during that time. One of the first laws passed by the BOH was the leper law. And the leper law chose an isolated island where they can house all leprosy cases to prevent the further spread of the disease. So natuto sila no from the quarantine. Sabi nila, if we gather everybody with leprosy and place them in an isolated island, quarantine them there, then maybe the cases of leprosy will lower in the country. True enough, they chose Culyon in Palawan to be the Culyon leper colony, no? And when you visit Culyon today or Palawan today, you will still be able to you can actually visit Culyon, the Culyon leper colony. In 1905, because of the need for more medical professionals, the Philippine Medical School was established under Commonwealth Act number 1415. Later on, construction ended in 1907 and the school opened at the current School for Dead and Blind located on Malicon Drive and now called Bonifacio Drive in Manila. In 1908, the University Charter Act of or Act number 1870 was passed and it formed the University of the Philippines. Later on, the Philippine Medical School was renamed to become the University of the Philippines College of Medicine and Surgery. And then in 1910, they opened the Philippine General Hospital. In June 1927, the University of the Philippines Institute of Hygiene was formed, and the UP Institute of Hygiene offered a certification of public health program for medical officers. This eventually gave rise to the School of Sanitation and Public Health, but in the mid-80s, they renamed it to become the UP College of Public Health. In 1918 to 1941, there was a Philippinization of health services and mandate of public health. This was after the American occupation. They were already transitioning the government to the Filipinos, no? So there was increased participation of Filipinos in governance. In fact, in 1919, Dr. Vicente de Jesus became the first Filipino director of the Philippine General Hospital. However, during the Japanese occupation from 1942 to 1945, diseases such as tuberculosis, malaria, and severe malnutrition again increased. And this was brought about by the scarcity of food and medicine all over the country. In 1947, please do remember this, it was the birth of the Department of Health, no? After the war, the Philippines was actually one of the top 20 nations with high tuberculosis burden. So the DOH, the newly founded DOH, was in partnership with the WHO, and they brought the vaccine called BCG or Bacillus calmette-guerin to the country. BCG is a vaccine for tuberculosis, which was the leading cause of disease or morbidity in the country during the 1930s. After this period, there were numerous laws and programs implemented for the promotion of public health in the Philippines. And one of those laws were in 1954, the Rural Health Unit Act. This promoted the establishment of clinics in every municipality. And then in 1963, the institution of the Food and Drug Administration. Eventually, during the martial law, there was a rise of several specialty hospitals, including in 1975, the Philippine Heart Center, in 1979, the Philippine Children's Medical Center, in 1981, the Lung Center of the Philippines, and in 1983, the National Kidney Institute. This was brought about by the implementation of primary health care during the Alma Ata Declaration, which we will discuss in Lesson 4. In 1963, the Philippines launched Project Maria. This was a government program which provided extended health services to the rural areas. Branching out from Project Maria in August 4, 1969 was the passage of RA 6111 or the Philippine Medical Care Act of 1969, also known as Medicare. So Medicare in the Philippines was actually patterned from the Medicare of the United States. It benefited only the employed sector, the poor, the elderly, and people with disability. So that was the only way of the government to help in the payment of medical bills. It was only available for the poor, the elderly, people with disability, and those who are employed. It was not until February 14 of 1995 to the passage of RA 7875 that the National Health Insurance Act of 1995 became a law. According to this law, the country should provide health insurance for the underprivileged, the sick, the elderly, the disabled, women, and children. So, in 1997, they established the Philippine Health Insurance Corporation, or more commonly known as PhilHealth. There are also other government agencies which actually aid in the assistance for the payment of our medical bills, such as in 1997, the GSIS, which is the insurance for government employees. In 1998, the Social Security System, also known as SSS, insurance for the private sector employees. And then in 2005, the Overseas Workers Welfare Administration, or OWA, which provided assistance for the OFWs. And that is the end of our public health discussion. So hopefully, you were able to understand our lesson. If there are any questions, you can email me or send a message through Messenger. Okay, thank you and shalom.